part in the elimination of NTDs. And that is what we are doing. And we want to encourage a lot of people to find avenues, companies, individuals, use your voice. When we're going to rural communities, you could join us, join the advocacy, and let's help eliminate NTDs. Because like we say, NTD is the disease of the shadows. It affects the most vulnerable in community, and so we usually don't talk about them. I'm not sure you've seen anyone with elephantiasis in recent times or in your environment, because they are hiding in the shadows. They are in the rural communities. Nobody cares about them.
You're right.
And that is why we're using the 9, which is the NMR initiative for NTD elimination, to drum home the point that we all need to come on board to help eliminate NTDs in Ghana.
Okay, so what are the stages in 9?
Great.
Which areas are there?
So we are focusing first on the research, and that is what Noguchi has been doing for so many years now. Now we're moving it a step further to the advocacy and then resource mobilization.
Okay.
Time was when USAID would just send money that Ghana use this to eliminate NTDs. But these days, everybody has been trumped. And so we need to now focus on internal resources. We need to now focus on galvanizing efforts locally. And that is the these are the stages that we look at: the research, the awareness creation, and resource mobilization. These are the 3 pillars that 9 is standing on, and we hope that all Ghanaians will come on board for us to push this noble cause.
Right. I was asking Dr. Kufu earlier how Ghanaians can help.
Great. So we are going to
Since
roll
we
up.
have marketing here, please tell us.
We are going to roll up a number of programs. First, we are launching a fund where Ghanaians can contribute their quota, be it 50 Ghana cedis, be it 100, be it 20 cedis. The last time we went to Ga West, some of the patients we encountered, they mentioned that some medications cost as low as 50 Ghana cedis, but they cannot afford. So they come and the hospital sometimes gives it to them for free because they can't afford. They mentioned that there are 3 stages of the medication. Some can't afford, so they will only let them pay for one, and the hospital takes care of the other 2. These are things we need to support, and we will be coming back to call on all Ghanaians to help us raise resources. We'll be launching a short code very soon where people can easily contribute towards the efforts that Noguchi is making by just dialing the short code, and with Momo, you could just send a 50 Ghana cedis. It may not mean anything to you, it may just be the cost of your breakfast, but that is what is going to help somebody in the rural communities who has elephantiasis, who has river blindness, to get the medication that he or she needs to get cured.
Okay,
so we will soon be coming to Ghanaians to humbly implore that you help us in our efforts to help eradicate NTDs.
We'll be waiting for that short code. Ghanaians like donating to a worthy cause. Okay, so in wrapping up our conversation, what practical steps do you think individuals can take, to contribute to the total elimination of NTDs? I'll throw it to both of you. Someone.
So I'll give it a shot. Okay. So in Noguchi, in our world of research, there's a new field we call implementation research, where we know that for a lot of these NTDs, there are proven interventions for controlling them. And so these interventions are available, and what we need is to get them to those who need them. One of the ways to get this is to make sure that we have the funding, the resources to get them across the people who need them. We also need to have education in place for those who know, those who have the conditions to know what they have, and to take personal protective measures, because some of them, like we said, they are easily preventable, and we don't want a situation whereby all we are doing is just treating. People need to be empowered so they know. So we'll do a lot of health education as well.
Okay.
Yeah, to empower people.
Oh, okay. So on the health education bit, when we started the conversation last week, what we realized, or what we learned, was that for most NTDs, the symptoms usually go unnoticed. And so people will tend to overlook them. Can you shed more light on these as we create awareness, please?
Yes.
Yeah, I think.
So what we want to inform the public is that anything that is unusual on you, get to the nearest health facility, because you may not be trained to tell this is an NTD or not an NTD, and that is why when Noguchi reached out to Amasaman, we did wound care. But these wounds have several causes. The trained eyes, the health practitioner, will be able to tell which is which.
Right.
And so once anything is unusual, please go to the nearest health facility. That will be the safest way to address it. A lot of Ghanaians are already personal doctors at home. Let's just go to those who are trained to help us.
Yeah, right. Adam, how about you?
So I would say
Yeah.
you should get in touch with the Noguchi Memorial Institute for Medical Research.
Okay.
Follow us on our various social media platforms because we will be rolling out a lot of activities, outreach events, and community engagement so that you can follow and know exactly what to do when you think you have an NTD or you have a disease that you don't really know what the cause is. Once you follow us and all the information we are putting out there, you will be educated. And also when we are going for the outreaches, you could also join or listen to the things we are telling the people, and that will educate you so you can know it. And for you to contribute, like I said earlier on, we have various activities like the short courses that are coming up. We have events. Once you are in touch through our social media platforms, the Noguchi Memorial Institute for Medical Research or the NMIMR Initiative for NTDs Elimination, which is 9, you will be updated and you can take the necessary action when the time is due.
Okay. And then if you're going for the outreaches, how can we join? If we want to join the team to go on outreach programs, how do we contact you? How do we join? Who can join?
Anybody can join. Anybody with an interest
Okay.
to help eliminate NTDs, you can join. All you have to do, like I said, follow us on the various social media platforms and get in touch. Just send us a DM and we will connect with you and take you along the outreaches.
Right. Well, thank you so much. Is there final things? So what has been planned, for instance, for the next 2 months at Noguchi? If we were to take a tour there, what's happening there?
So I would say that one, as a final word, to say thank you to GTV, and then also to remind us that the NTDs are the only conditions that have maintained a consistent theme over the past couple of years, which is to unite, act, and to eliminate. Let us unite stakeholders, resources together. Let us take actions and not just speak about the conditions. And the goal is to eliminate. And so it's not going to be just a 9-day wonder. We are going to let our actions reflect this theme. And so that is what we expect to see in the year, in the months ahead of us. Noguchi will continue to do a lot of advocacy. Noguchi will continue to actually reach the people who are affected with life-saving support that they need, because we think that that is how we have eliminated 3 so far. We need to continue the same approach to get more eliminated with your help.
Right, thanks.
Brother,
Final words, you
Final words.
Surely add to it.
Yeah, definitely.
Well, I would like to use this opportunity,
Yes.
craving your indulgence, to thank our sponsors who helped us make that program successful.
Definitely.
Noguchi, as a state institute, doesn't have funding for some of the things we do. And if not for Newmont and Republic Bank who came on board to help us, I'm not sure we could have done this. So we are grateful to them, and we pray that a lot more companies will see the good work we're doing and come and support us, because we don't have the resources internally. And since external resources are not coming in, we only rely on the Guinean organization. So a humble plea to all Guinean companies to reach out to us, and we will come out to them. Yes. They should open their doors to us. Yes. Thank you very much for the opportunity.
Yes, and our doors are open to you anytime. Thank you guys for coming in, for doing an amazing job for Ghana. Thank you so much.
You are doing great as well. Keep it up.
Thank you so much. We've been having a conversation with Dr. Richard Akuffo. He's a research scientist with the Noguchi Memorial Institute for Medical Research, and Edem Dopignon, he's Marketing and Resource Mobilization Officer for Noguchi Memorial Institute for Medical Research as well. We've been having a conversation on NTDs, and we are waiting for that shock code because 9 has started. So we are waiting for the shock code where we can donate just a little you have to help unite. We're going to be acting and eliminate NTDs. This has been our conversation. We'll take a break. When we return, there's more on the show. There are conversations around the NPP's next move, unity and reconciliation. We also have conversations. We're going to be speaking to Blacko. We had a conversation earlier, and we're going to do that playback for you. So there's lots to look forward to on our show. It's still GTV Ghana Breakfast Show. We'll take a break. We'll see you shortly.